Hi, everyone. It's Amy Chandler from ECHN's Diabetes Wellness Center coming to you on another Motivational Monday. And we've been working through this month of August focused on National Wellness Month. We've been talking to you guys about areas of wellness like being conscious of your sugar intake. We've talked about how having a positive self-identity can help you in your wellness goals and how that emotional component plays into your wellness. And today what we're going to do is focus a little bit on an area of our life that is sometimes overlooked, and that's going to be sleep. So as you know, sleep is an important part of being healthy, but we don't always think about it in terms of how it can affect maybe a chronic disease. And so we are passionate here at the Diabetes Wellness Center on diabetes prevention and the management of it. So I want to talk to you today about sleep and its effect on those two things. And I'm going to break it down into the hormonal component and also the behavioral component. So let's talk about the hormonal component. So the primary reason that regularly skimping on or having less sleep can put you at risk for type 2 diabetes or increase your risk is because your hormone levels get all thrown out of whack. So specifically, when we're talking about sleep deprivation, less insulin, which is the hormone that regulates your blood sugar, is released in your body after you eat. But at the same time, your body is secreting more of the stress hormone cortisol, which helps you stay awake, but it also makes it harder for insulin to do its work. So unfortunately, you're getting like that double negative going on there. So what happens is too much glucose stays in your bloodstream, which can increase your risk of developing type 2 diabetes, or if you have type 2 diabetes, it's going to make it harder for you to control your blood sugar. So that's something. The second thing is the behavioral component of it. And I'm sure we can all relate to this. If you've had a bad night's sleep, the next day, you're not really eager to stick to your healthy behaviors, right? So getting too little sleep can definitely increase your appetite, and it can reduce your level of satiety, right? So you're never really feeling full. You're never really saying, oh, I can move away from the table because I feel full. It causes you to crave carbohydrates and sugary foods. And over time, those cravings and that overeating can wreak havoc on your blood sugar and your insulin, adding to your weight possibly, and just making you overall have less energy, which can actually decrease your motivation to be physically active. So there's a definite hormonal component to not getting enough sleep, and then there's a definite behavior component to not getting enough sleep. So what can we do about that? Well, right now we're living in a state of a little less control in our lives, and I think a lot of us have gotten off of our normal routines. So the challenge this week is to try to create a better bedtime routine for yourself, where you put a specific time that you're going to go to bed every night, and try to stick to that with little helping things along the way. Maybe you choose to read a book before you go to bed. Maybe you're going to choose to have like an herbal tea to settle you down before you go to bed. Maybe you decide to take a bath before you go to bed. So the challenge this week is to try to create a bedtime routine and stick to the same bedtime every night for a full week. All right, we'll be checking back in with you guys to see how you're doing. And once again, if you've liked what you've heard today and you want more information about the program that we offer, don't forget to visit us at www.echn.org/block diabetes. You can find all the information about the diabetes prevention program there, or the diabetes self-management page on echn.org. And we look forward to talking to you guys in the future. Thanks so much.